just want him up here. Right here. Hi, buddy. So we're going to put him here. Let's see if we can get him to lay down. Yeah, hi, bud. Go ahead and sit. Sit. So have him sit, and then we're just going to lay him down. And I can show you some simple stretching. This is why I bring treats, right? All right. Hey, bud. Should we sit? Sit. Sit. Good boy. Down, down. Good job. Look at these feet, okay? Hey, good boy. So, there we go. So my apologies. It's always hard to demonstrate and not be in the way. So this is his right limb. And so when they come in, often I'll use something like this, a goniometer, simple tool that many physical therapists use in the human and animal world. What I want to do is just establish, what does this dog have for range of motion coming out of surgery? I usually get these dogs about 2 weeks post. So would you imagine they're not going to have full range? Yeah, right. So I take measurements like that. I put them all down on paper. It's good baseline for me to know. I also send that off as a report to the veterinarians. Okay? So just simple range of motion. Let's start with this dog. Real easy of just bending up his knee. I've got my hand up here in his femur. I'm trying to isolate just the knee. I can bend the whole limb, but for, let's just say for purposes of just focusing on his knee. Do you want me to take those? Yeah. There we go. So just bending and stretching it back out. And so we teach the owner this the first day they come in. Very simple and gentle. I'm not forcing anything. And I always tell people, just to give people really easy landmarks, you know, I don't say, oh, you need to get this dog to 30 degrees. Well, they don't have a goniometer at home. They have no idea what I'm talking about. I always say you can always compare it to the other limb, if the other limb's normal. Or I say, you see this bone right here? This is their heel bone. And up here is their butt bone that you and I sit on, okay, on their pelvis. And I say you want to try and get your heel bone up towards their butt bone. Just slow, steady pressure. Okay? Up and down, up and down. So that's just basic range of motion. We can also incorporate the whole limb. And a trick is, I'll say, just stick your finger in their website, or their website, space, and they'll flex, you know, because we can also get some stretching here at the ankle, okay, and the knee at the same time. But again, if this dog had a TPLO surgery, which again would be another whole day lecture, but so sometimes dogs that have had a TPLO, they might not get all their ankle motion recovered because it changes the angles on their tibia with the surgery. But okay, so that's that. And then another area, if a dog's been walking around three-legged, they're going to be tight in their hip flexors, right? So right where my hand is are his hip flexors. So another stretch I usually start the owners with on the first day is just hip flexor stretching. And right now he's just being a wiggler. One great technique is rubbing them, then they don't focus on it as much. So I've got my hand above the surgical area, and I'm just gently bringing his limb out towards him into what we call hip extension. Does that make sense? If you've been walking around three-legged and you've been overusing these muscles, that they're going to be sore and tight? Yeah. So again, I measure these, and they're often tight, and then the goal, again, is to get them back to restored full range of motion. And it's also going to help carry over in terms of function of helping this dog get his full stride length back. Okay? The other muscle group I might take a look at with a knee dog would be his hamstrings back here. Just like you and me, if I've been walking around my knee partially flexed, my hamstrings are going to get tight. What happens when our muscles get tight? They get muscle spasms. They get painful, right? They get pain. It's not great. So again, I'm going to bring his leg out, his knee out into full extension, and then I'm going to start bringing his toes towards the front of his body to stretch his hamstrings. All make sense? Okay. So those are very simple things that we start with teaching people right on the first day, and give them out handouts and make sure they're comfortable with it, so they can go home and work on these very simple things right in the first day. Let's get him done. Okay. We don't let him jump off the table after a knee surgery. So another thing, really simple, that Darlene's been working on is just sit to stand. So ask him to go ahead and sit, and then stand and back up. See, I know you need more than, so just see if you can do like 5 of those in a row. Okay, so sit and then put the treat, no, so sit, Darlene, and stop him. Now, just stop, no, stop treating him. Now back up and put the treat on the floor. Good. So sit and then back up,
Okay.
and put the treat on the floor, really quick. So Darlene's went on vacation for a week. So
I'm doing the,
Here we go, let me hug for a minute. Let's see.
Sit and drop behind him.
Yep. Sit, sit, Good boy, stay. Go get it. Good. Sit. Go get it. Sit. Sit. Go get it. So I want him sit, stand, sit, stand. What are we doing? We're doing squats with the dog, right? And so we have her do 10 of those because he has to squat. Now we're also not only doing muscle strengthening with squatting, but he's also getting full knee range of motion. It's restored, right? Back into a functional position of sitting. Oh, and then we're moving right on to our dynamic exercise. So this is why I picked this dog. He's great. So now, if I want to really focus maybe, and this is a great way if somebody asks me about introducing something. So dogs really hate the wobble boards because they don't like to be unstable. But what I can do is put his front feet up here, and I'm going to wobble him. And where's he put more weight on right now? If I elevate his front end. He's putting more weight on his haunches, right? So I can be making that, now if you just put your foot on here, Charlie.
Down the end.
Just, yeah. And now if I weight shift him by poking him, I'm going to push him right onto that right hind even more. Make that hind, can you see those muscles working? Yep. And then I can even, she's wobbling him, I can start moving his head back and forth. And so we're working all on his core strength, and I'm trying to really focus by pushing him onto that right hind even more. Does that make sense? So that's how we try and do some strengthening activities with them. And then with this dog, he's small enough that we can probably get him, he can take a break for a minute. We can probably get all four on there. So
really?
Yeah, you're so easy. I'll give those to you.
Okay.
Good. So you're going to get all 4 feet up here. And I'm just going to, and the first thing they want to do, they want to sit down because they want to get more stable. It's like, no, that's not the goal. And so I'm going to keep my hand here so that he can't sit. And I'm going to spread out his feet a little bit. And now I can really rock him. And like I said, I can focus more on the haunches by tipping them more down this direction. That make sense?
Mm-hmm.
And so owners can do this at home. You can take it off for a minute. Owners can, owners often ask, where can I get one of these? We make these, they're on the internet. You don't have to go buy something, you can just use like an air mattress. Anything that's unstable is gonna make the dog recruit more. It's just like you or I on a motorboat and you see waves coming, right? You have to like tense up because you know that you're gonna go doom, 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 right? So anytime that you can destabilize a dog, you're gonna recruit more core muscle and strength. And balance. So for our neuro dogs, we put them on here, and that's not easy on them either. One other very simple exercise is asking the dog now, do you have more, or do you want me to get more?
I have a few, yeah.
Okay,
Just
so
step
ask
up.
him, yep, you stand there and I'll be here.
This side?
Yeah, let's give him a side
Here,
view.
Joey.
There we go. You
Step
come
up.
over here and just have him step up.
Good. Step up.
Good, and he's so good. So,
Uh-oh.
So now this is one of the, let's say a dog comes to me first, we might just have him do one step, but this dog's a superstar. So, and he's doing a nice job here showing us. Now the other thing he's doing here is stretching his hip flexors, right? Remember I was showing you how to passively do it? I like this because now it's in a more functional position. The dog's getting nice extension in his hip, all on his own, and he's having a great time. We ask her to just do 30 seconds, so go ahead and introduce him to come on down. Now this would not be a good activity for a dog that had disc problems because now we're stacking the spine, right? Dogs were built to be horizontal. When they have a disc or a back problem and you start putting them vertical, that's not what we want. You're gonna get more joint compression and possibly nerve and disc compression. Good boy. So now, once I get him up here, I can really wiggle him more to his right by bringing his head to his right to hope that we're putting more and more weight on that right hind. Okay? You are a superstar.
We were doing the one
Yeah.
sit and I would toss one back.
Okay, yep, go ahead, do that.
Joey.
Good, so what she's talking about there, that would be advancing our sit to stand. Now we advance it to sit to stand to his right side. Because the hope is that if he's here and the treat goes there, he's got to push up and more weight is on this right hind.
I'll wait right here.
Yeah, he's good. Questions, thoughts?